And I'll be talking about how Spanish names work, because that confuses a lot of people in the United States. So we'll be talking about that. As you can see here, we have a picture of Yolima. Some of you may know her. Yolima is a community health worker, and she used to work at El Centro Hispano. Now she works for Duke Health for the Population Health Management Office, the LATS program. It's a program that works with the uninsured in Durham County. And she's here meeting with some teenage girls from Central America. So the first thing that I wanted to talk about is, welcoming the Spanish-speaking population. Most of them are immigrants, some of them are not. For example, we've worked with Puerto Ricans, they're US citizens, but their primary language is Spanish, and when they come from the island to the mainland, sometimes they have difficulty communicating. So anyway, when you move from another country, you reach a place that is unfamiliar to you. There's a different language, different customs. Sometimes you don't have the social support that you have in your home country. And some people are fleeing violence. Not all of them are, but some of them are fleeing violence and difficult situations. So it's very important that when they come into a clinic, the health department, any institution, they feel welcomed, and that's a place that they feel comfortable going to, because that way, they will have access to services, especially health services that are important, so that they can get preventive care. Now I'm going to talk about the Spanish names, which is, one of the most interesting things that sometimes we encounter. So in most Spanish-speaking countries, individuals have two last names or surnames. So for example, I mentioned my name is Angel, that's my first name, and then Romero, and then Ruiz. So Romero comes from my dad, Ruiz comes from my mom. And as you can see, in this example, we have a gentleman called Jose Alvarado Perez. His first name is Jose, last name's, so first name is called nombre, last name is called apellidos, and it's plural because you normally have two. And it's Alvarado Perez. And then you have a lady, her name is Maria Guadalupe Sanchez Morales. As you can see, she has a double first name. So we normally don't have middle names. Some people may call it middle name, but for example, I don't have a middle name. I just have a first name and two last names. I have a brother that has a double first name. His name is Francisco Jose, but we consider that the entire first name. So Maria Guadalupe, her first name is Maria Guadalupe, and then her last names are Sanchez and Morales. And women do not change their names when they get married. So in the US, it's very common for a woman to take the husband's name, and this doesn't happen in the majority of the countries that are Spanish-speaking. My sister, for example, her name is Adela Romero Ruiz, last name's the same as mine, and she's always been named that way. So she got married twice, she never changed her name. So here we have this couple, and they get married, and they have kids. So traditionally, children inherit the father's first last name and the mother's first last name. So you can see Jose Alvarado Perez, the kid named Enrique, his name is Enrique Alvarado from his dad, and then the mother's name, Maria Guadalupe Sanchez Morales. So Enrique, his second last name is Sanchez. So that's how the names work. And this is the traditional, usual way. You may encounter exceptions, but this is the general rule. And here we have another example. So for example, Miguel Herrero Ortega marries Rosa Juarez Navarro, and the little girl, her name is Maria Luisa Herrera Juarez. So that's the way the names work. And it's important to know this because when individuals that come here from Spanish-speaking countries, and not just Spanish-speaking countries, I've encountered Koreans, Arabs, people from other nations that have more than the regular, first name, last name. So that confuses a lot of places where they need to register at, and then their names get messed up, and that's not helpful. I used to do care management, and sometimes I would find 3 medical records for the same person. So that's not very useful for providers and for anyone that's trying to track someone's health. And then regarding same-sex marriage, so it varies a lot in the different countries. Right now, as far as I know, same-sex couples are legal in Argentina, Ecuador, Colombia, Uruguay, and Spain. And Mexico has same-sex marriage in over 50% of the states, but Mexico is not nationwide. So apparently some states allow it, some states do not recognize it. And how they marry, how they name the children, there's probably some type of agreement between the couples, because I'm not sure what rule they would follow, but there's probably some type of agreement between the couple. So the other issue that also leads to confusion are birth dates. So outside the US, in the majority of the countries, the dates are written in the day, month, year sequence. So for example, September 4th, 2019 would be written 9/4/19. So if Jose Alvarado Perez was born on October 2nd, 1969, his birth certificate would show 2/10/1969. So as you can imagine, that could also lead to confusion, because sometimes people's birthdays are, turned around. So that's also important to know for registration purposes. So when you look at birth certificates, it's important to look at that. And then what I mentioned earlier, registration. So a lot of staff that do registration of clients or patients, they're unfamiliar and they get confused with Hispanic surnames. Many times they're often modified by clinic staff when they register. I had problems when I went to the DMV. Even though I told them what my legal name is, they still messed it up. So the next time I went to the DMV, I brought my US passport, my social security card, and I said, please put it as it says here. This is my legal name. So it's important to pay attention and look at what the individual's name is so that you get it right. And sometimes the patients or clients are not asked to verify if their information is correct, and the individuals themselves don't verify their information, so they should be encouraged to verify it. And sometimes Hispanic names are not compatible with computer systems. So I remember when I worked with individuals that had Medicaid, the North Carolina Medicaid system would not allow 2 last names. So what they would do is they would join the 2 last names into one. So sometimes especially the kids had really strange last names. They were long and combined. And sometimes even though the individual presents themselves with an accurate name, it gets keyed incorrectly. So that's why it's always important to verify the names in the paperwork. And I wanted to switch to working with interpreters. So when you work with individuals that speak foreign language, ideally the best way is to have bilingual staff that can communicate with them, but obviously that's not possible in all cases. So we use interpreters to communicate with individuals so that we can communicate with them adequately. And it is very important when you use an interpreter to maintain primary eye contact with the patient or client. So if you have if you're a provider here and I'm the patient and there's an interpreter there, you shouldn't be looking at the interpreter. You should be looking at the patient or the client. And this is very important. I've worked as a medical interpreter, and I was very frustrated because even though I would tell everyone the rules, sometimes there was one provider just kept looking at me, kept ignoring the patient, and it was kind of frustrating. But it's important to do that. Also, don't talk about a patient or an individual in his or her presence because everything that is being said should be interpreted. You cannot have side conversations. If you want to have a side conversation, you need to leave and take it out. But as long as someone is there and needs interpretation, they should know what's being told in that space. And sometimes the patients or the clients, they understand a little. They may not speak English, but they understand it. So you have to be careful because they may know what you're saying. And everything you say will be interpreted. Like I said, treat the patient like an English speaker, because that's what you have an interpreter there for. And remember that interpreters should always use first person. So when you're talking to a patient, for example, if I'm interpreting, the patient says, you know, my stomach hurts, I'm going to say my stomach hurts. I'm not going to say he or she's saying that her stomach hurts. So it's important to know that. And do not ask patients to bring their own interpreter. That's not a good idea. We want professional interpreters. And you know, most institutions here at the health department and at many of the larger clinics, they have interpreters. Also, do not ask another patient or another client to help you interpret. And please do not use children or family members or non-qualified staff. Especially with children, I've seen it happen. Sometimes it's convenient, but the thing is that sometimes adults who don't want to say things that they don't want their children to hear, they're embarrassed. So, you know, you wouldn't want, sometimes imagine yourself talking to a doctor and saying some things that are very touchy, so very private to you, and you wouldn't want your kids to know that. So, try not to do that. And also, you know, while you're having the conversation with the individual that you're using an interpreter with, you know, try to have a comfortable pace, use short sentences, because if you just go on and on and on and on, the interpreter is not going to be able to memorize everything you said, and there's going to be parts of the conversation that are going to be left out. And the same thing needs to be told to the client or the patient, you know, because sometimes they'll go on and on, they want to tell you a really long story, and then you have to say, could you please, you know, say it in shorter sentences, because otherwise communication is going to be made more difficult. And also avoid medical jargon or specialized terminology to make the encounter less complicated. And also listen without interrupting. Now I want to show you something that I'd like to get your input. So here we have a young woman. Where do you think she's from? Any guesses? Hmm?
Colombia, Panama.
Say Colombia, Panama, Dominican.
Dominican.
From the Pacific coast of Colombia. Well, her name, she's a famous singer in Europe and in some parts of Latin America. Her name is Concha Buica. She's from Spain. She lives in Miami, she lives in Florida, but her parents were from Equatorial Guinea in Africa, but she was born in Spain. Her primary language is Spanish, and so you could say she's Hispanic, even though she looks like a black woman. People would confuse her with an African American. And this one's an easy one, right? Most people know. Cameron Diaz. So she is, her father is Cuban American, so she's part Hispanic. How about her?
Hawaii.
And her first name is Keiko.
No, she's from Peru.
Peru? Oh, okay.
Oh, someone got it right.
The daughter of the former president.
Yeah, so she's a Peruvian politician, Keiko Fujimori. She's the daughter of the former president of Peru. So Peru has some population that is of Japanese origin. So they look Japanese, they have Japanese names, but they're Spanish speakers. So she's Hispanic. And some may recognize her. Do you know who she is? No. So she's a singer. Her name is Lila Downs. So Lila was born in Mexico. Her dad is American, so she's a U.S. citizen. She grew up in Minnesota. Her mom is a Mixtec Indian, so that's an Indian tribe in Mexico. And she speaks Spanish, English, Mixtec. And she was very Americanized. Like I said, she grew up in Minnesota, but then she rediscovered her Mexican side and met with her grandma, and she likes to wear these colorful outfits, and her latest CD talks about chiles. Chiles. So, as you can see, the Hispanic community is diverse. This gentleman, he's a pretty well-known salsa singer, Ruben Blades or Ruben Blades. So he's Panamanian, and some people may know him because he's also an actor. And he appears in one of the zombie series, Fear the Walking Dead. So he's in that series. So the Hispanics could be mixed race. So the majority of the people that you will encounter, probably from Mexico, Central America, some parts of South America, they're going to be mixed race. So they're usually a mix of European and indigenous individuals, Native Americans from different parts of the Americas. But they could also be white. They could also be indigenous. So there's still quite a sizable indigenous community in some parts of Mexico, in Bolivia, and some other parts of South America. They could be black, so you're probably going to be seeing a lot of black Puerto Ricans and Cubans, and then there's also some in Colombia, Peru, Venezuela. And they could be Asian, so there's people of Asian origin. It was funny because I was in Dallas once, and I was talking to this woman in English. She looked Chinese, and then she looked at my badge and she said, "Hablas español?" And I said, "Yeah." And she was Chinese Spanish, so she spoke Spanish. So the ethnicity is really more of a cultural aspect. So, you probably hear terms like Hispanic, which is the one I use. Hispanic normally has to do with the culture and the language you speak. So normally the people that come from Spanish-speaking countries would be considered Hispanic. Then you've probably seen Latina, Latino, and Latinx. Sometimes people are using Latinx for all, men, women, and the LGBTQ community. I don't like to use it for the entire community. There are individuals, including some of my coworkers that are Latinas that do not like to be called Latinx. They don't like it. They respect the Latinx community, but they don't think they're Latinx. So the difference between Hispanic and Latino, Latinx is that Latin comes from Latin America. It's more of a geographical area. So what happened was, before the term Latin American was used, people used to talk about Hispanic America, Ibero-America, which was Portuguese and Spanish-speaking America. And then Latin America came up when they wanted to include the French-speaking population in the Americas. So it's the languages that come from Latin, so those would be French, Portuguese, and Spanish. So that would be the difference between using Hispanic and Latin or Latina, Latino, Latinx. The national origin, so some individuals prefer to be identified as Mexican rather than Latinos or Hispanic. The same, people from other parts of the Spanish-speaking world, but normally they would come from parts of North America. So Mexico is considered North America. Some Americans put Mexico in Central America, and Mexicans don't like that because they're part of North America. Then there's Central America, South America, Caribbean, and then Spain. The history, so you may encounter individuals that are fleeing war, violence, natural disasters. So the U.S. gave visas to some Central Americans that were affected by hurricanes and by earthquakes. Some of them have something called TPS, temporary protected status, so they're legally here. with a legal visa. To that Marianismo, they may pray, and they may, even though they might be Catholic, there are some non-Catholics that also do this Marianismo because it's become a tradition in their countries. Then family dynamics are important to know. In the United States, we're used to people being a little more individualistic, but in a lot of the, especially recently arrived communities, their families are very important, and sometimes important decisions are made consulting with the family. So they're not going to decide what to do unless they check with other family members. And then they have a lot of respect and trust in authority figures. This could be good, could be bad, but they respect physicians, attorneys, notarios. Notarios is where we get into a tricky situation. So notarios are notaries, and outside the U.S., notarios are attorneys. So they're people that are very well qualified. They usually work with you on real estate and other documents that are important, and they charge you for that because that's part of their job. In the United States, most people can become a notary. I became a notary for a couple of years, and you don't need to be an attorney. So sometimes there are individuals here that are notarios, notaries, and they act like they're like an attorney when they're not. So some members of the community have been scammed by some of these notarios. And they also respect religious figures, so a priest or a pastor. They usually trust what they're being told. Some individuals practice alternative medicine, and there's a term you may have seen. It's called curanderismo. Curanderismo is like folk healing, and sometimes Hollywood has painted curanderos or curanderas as witches, and trying to make them creepy and all that. But it's basically they're people that are knowledgeable about herbs and about some non-pharmaceutical ways of treating physical or psychological or some other conditions. And some of the most common are mal de ojo, it's evil eye, susto, which is fright or fear. Someone will say, oh, I got a big, scare, and I need some help with that. Empacho, which is colic, sometimes they feel bloated or full. Or mal puesto, which is a hexing, they got a hex. So the curanderos, they use different methods. Some of it might be prayer, some of it might be herbal remedies, rituals, psychic healing, spiritualism, and then massage, which is called sobar. There are people called sobadores or sobadoras, and they do this rubbing technique that helps the individuals cope with their condition. So some of this, some people may look at this and say, well, a lot of this is, just hogwash. It's not based on science, but a lot of the herbal remedies, I remember when I was a kid, my mom took me to the doctor, and this was an MD, and he would prescribe medication, but sometimes he would say, oh, he's just got just give him a chamomile tea, So that's, sometimes there's some of these simple methods that, don't require taking a pill for everything that might be a little healthy for you. And that's pretty much it. So, does anyone have any questions?
Back up to using the name. Do you feel it's appropriate when someone stands registering gives you one last name? Before you answer that, when I see one last name, I ask if they have a second last name,